I get messages all the time asking me about my proctocolectomy surgery, and it's usually somebody who is worried they might be looking at the surgery or they've already got it on the books, and they're wondering what they're going to feel like and look like afterwards. This is a very permanent surgery. I mean, once they take out the colon, the rectum, and they sew up the anus, that's it. There's no reversing that. There are so many things that this surgery has given me and opened up for me. But I also think it's really important to share what it's taken away. Hey guys, it's Maggie and I am back today, and today I want to talk about what proctocolectomy surgery has taken away from me. I always say that I wish I had gotten this surgery earlier, like when I was 16 and I got my ostomy. But the truth is that when I was 16, I just didn't know what I now know at 30. I hadn't gone through all of these experiences that ultimately led me to the decision of getting proctocolectomy surgery, something that is so permanent and so irreversible. That's not to say that my disease did not impact me as a child. I was diagnosed fairly young and had a lot of traumatic experiences with it. But it ultimately took me 10 years from the time that I had my ostomy surgery to get to the decision of, yes, I want to go through with this. And it wasn't just about my disease coming to a point where it was necessary, it was also me coming to a point where I was ready for it. There were a number of things that I really had to think about and consider that 16-year-old me, those things were not on her mind. She was in a completely different place than I am at 30. While I do kind of fear sharing about the things that this surgery has taken away from me, because I'm worried that I'm going to worry you. If you're facing this surgery, I don't want to scare you away from it, but I want to provide you all of the information, not just the positive stuff, to take back to your surgeon and ask about and have a conversation about. It's also really, really important to remember that as patients, we are all different. Our diseases and our surgeries can affect us so differently. But I'm telling you my experiences because they are a possibility. I think what really impacted me the most first was having to leave my job. I was working as a bedside nurse in a hospital, and I was getting sicker and sicker. I could feel my colon just making me weaker because it felt like it was taking up all of my energy. And so I had dropped my time. I was full-time, then I went to part-time, and then I went to flex. And because I was a flex nurse, I was not eligible for FMLA. When I started to look into this surgery and we got it scheduled, I began talking to my manager about the surgery, and she wanted to know exactly how much time it would take for me to recover from this surgery. And I couldn't give that to her because I knew that some people did really well and their incisions healed perfectly and they never opened up, but it's in an awkward spot. They're literally like closing your hole. So I knew that it was going to be potentially difficult to heal. And that's exactly what happened. So as I was trying to have this conversation with her, as the weeks went on and I got closer to surgery, I had to make the decision to leave that job because I knew that I would lose that job anyway if I went over the 8 weeks of recovery that they'd give me. And I went over it. I don't think I could have gone back to, 12-hour shifts, being on my feet all day. I stupidly went on a work trip for another job that I had. I kind of made a transition to work as a telehealth nurse at that time. But I stupidly went on a trip to California to a work conference, and I was taking all the precautions. This was about 2 months after surgery, maybe actually like 10 weeks after surgery. And my incision split that far out. And it wound up not healing for a year. So I could only imagine just being very active as a bedside nurse. I don't know what would have happened. I also was in a good amount of pain and was not sitting correctly. Like when I flew out there, the plane trip was interesting and I was sitting on cushions and stuff. So yeah. Another thing that was really, really impacted, and I probably get the most questions about this, is intercourse. Because of the location of the surgery, it is so proximal to your reproductive organs, and it just made everything so tight. My pelvic floor therapist thought that it was probably my body's way of trying to compensate for the loss of support from my rectum and the other organs, but it was just so tight. And obviously we didn't have intercourse immediately after surgery. We waited a couple months, but when we did, it was so painful. I would cry sometimes because it was so freaking painful. I also noticed the pooling. I've talked so much about the pooling, but I had this outpouching that was created once the rectum was removed, this little outpouching in my vagina, and it caused pooling of my period and, normal discharge throughout the month. And I thought it was a fistula. I mean, that's what they tested me for, and it just wound up being, I collect fluids in there. I've got a nice little pocket that it likes to sit. Now, unfortunately, I was not recommended to pelvic floor therapy right away. I think that should be standard across the board. If you are getting any sort of surgery in this region, you should be going to pelvic floor therapy. I don't care if you're a man, woman, fish, bear, whatever. You should go to pelvic floor therapy. It was rough and it was painful, but it made such a difference. And now I am more comfortable during intercourse than I was prior to proctocolectomy surgery, because you got to think, my rectum was fairly diseased. It was a mixture of Crohn's disease and diversion colitis because I had been diverted with an ostomy for 10 years. It was painful. It was painful down there. If you're heading towards proctocolectomy surgery, demand pelvic floor therapy. It really just changed the course for me. In this same thread, something else that I just didn't really think about, and it's impacted many different aspects of life, just little things, that's scar tissue. It's not my first rodeo when it comes to having surgery, abdominal surgery, so I have definitely had scar tissue adhesions in me for a while. But when I had proctocolectomy surgery, it felt like something changed, I had Crohn's disease that was on the outside of my vagina. I had a fistula tract that I wasn't even aware of that went from my rectum to my tailbone, which makes a lot of sense now because I've had a weird looking spot on my tailbone for a long time. But they just found all this in me. And each time that you get abdominal surgery, it gives your body more chances to create these adhesions and this scar tissue. And I wasn't even aware of it when I had this surgery. I got the surgery done, they removed the stuff that they needed to, told me about the fistula, and I went on my way. But it wasn't until, I think, 6 months later, I want to say, I wound up having to go back to get surgery for my kidney. And during that surgery, they discovered I was full of scar tissue. So I got a nice little 2-for-1 deal. I got my kidney taken care of, and I also got a full clean out of adhesions. And can I tell you, that was so painful. That surgery was more painful just as a whole than any other surgery I've had. But once I healed from that, I don't even know how to explain it other than I felt flexible. I felt like I could move around again. You don't realize how much of an impact each surgery that you have has on this scar tissue and how it can kind of take over your insides. I don't think that I'll be the same. I know I won't be the same. Let's put it that way. I know I won't be the same. Every surgery impacts me, and it impacts just little things in life, like I can't lay flat. Laying flat for me is so uncomfortable. I have to be propped up on pillows, or I have to be on my side kind of curled up, because when I lay flat, it just feels like everything is pulling in my stomach or in my abdomen. It kind of worked out because after I had the proctocolectomy surgery, you kind of feel like you tighten and you want to curl forward. We wound up having a bed. We got a bed like a couple years prior to this. It's kind of like a hospital bed, but it raises. You can lift the head, you can lift the feet, you can do all these different things. And that was a game changer. And I don't think I can ever go back to a normal bed because it just allows me to be comfortable, especially right after surgery, when you feel the most like you're gonna curl into yourself. So it impacts all these little things like laying flat in a bed that I didn't think of before. And I think one of the hardest things, especially like now, that this has impacted and seemingly, at least for the time being, taken away from me is my ability to get pregnant. I actually was aware, this is probably the one thing that I was aware of going into this surgery, is that because of how close it is to your reproductive organs, it can make it very difficult to get pregnant. And so I asked my surgeon about this going into it. I said, what have you seen? Have you seen this be impacted? And he said, no, his patients have been fine. I'm going to take a wild guess and say I was probably on the younger side of getting this surgery done compared to other patients he's had. So I was probably one of the few that actually might try to get pregnant. But yeah, it doesn't seem like I can, at least without intervention. And that's been really hard. It's been 2.5 years, nothing. I have never seen a positive pregnancy test, done all the things that you can do at home. And as some of you guys know, I did go to a fertility specialist like 1.5 years ago. And as somebody who's had a lot of surgery, the procedures and tests that they wanted me to do felt very overwhelming at the time. So that's been one of the hardest things, is that I can't seem to get pregnant without further intervention, and that's hard. And I also think I'm just at a time in life where my brother has 2 kids, like little kids, and my friends are starting to either get pregnant or have kids. I want that too. So it's just, that's something to think about if you're heading into this surgery and that's important to you. If any of you guys watch Hannah Witten on YouTube, she specifically put off this surgery so she could try to get pregnant, and she did. For me, even knowing what I know now, knowing that I haven't been able to get pregnant, I would have still gone through with this surgery because I felt so miserable beforehand. I couldn't imagine living with that diseased colon and rectum and having a child. That would be awful. So definitely, if that's something that you want, that's important to you, definitely consider it. Definitely talk to your surgeon about it. I know that this surgery is just a really big decision to make. It took me a really long time to finally find a surgeon and say, hey, can you take a look at what I've got going on? Can we get rid of it? It can impact so many areas of your life, some that you may already be thinking of, and some that you may not realize until after the surgery's already completed. It's a decision that you, alongside of your surgeon, need to make to decide whether or not it's worth it for you. It was 100% worth it for me. I was so sick of the rectal pain. I was sick of the fluid that would leak out because your colon continuously makes mucus that you have to expel. So even if you've been living with an ostomy, if you've still got a rectal stump or some of your colon, that's something to expect. And I was sick of the hours spent sitting in the bathroom trying to expel this fluid through a very extremely narrow stricture. I was so over it. I was so sick of the pain. I was sick of the bloating. I just reached a point where I said, you know, I am at a comfortable spot in life where not only does I think my disease require this surgery, but also I am able to handle it at this moment in time. I'm able to take the time to recover. I have the people around me that can help me. I've got the space to do it. I've got the resources to do it. So that's why I decided to do it when I did it. I really hope that this video helps you in your decision making, gives you the information to take back to your surgeon to ask about. I get it. It's hard. It doesn't come easy. And like I said, I get a lot of messages asking about some of the things that I discuss in this video that I've either struggled with or have lost because of this surgery. Anyways, thank you so much for watching this video. I hope that you are feeling great, and I will see you guys soon. Bye, guys.